afternoon, everyone. Welcome to the Philippine Geographical Society Lecture Series 2021. This is the 13th session of the lecture series that we are conducting this year. The PGS LS is a project collaboration between the Philippine Geographical Society and the UP Department of Geography. I am Darlene Oxenia Gutierrez, and I will be your moderator for this event. Before we proceed, let me just iterate a few house rules. During the presentation, attendees will be on mute, but we encourage you to interact by typing your comments and questions in the chat box. Questions will be addressed during the open forum. This lecture is being simultaneously streamed in the UP Department of Geography YouTube channel. Also, please note that this meeting is being recorded and will be made available for viewing after the event. To begin our session, I would like to call Professor Eman Garcia, the President of the Philippine Geographical Society, to give the opening remarks. Eman?
Thank you, Ma'am Darl. Magandang gabi po sa ating lahat. Welcome to another episode of the PGS Lecture Series 2021. As always, I am delighted to welcome everyone in this evening's lecture on behalf of the Philippine Geographical Society and the UP Department of Geography. This is the second PGSLS we are having this month, but the lucky 13th lecture of the series. And amidst the pandemic, this is our way of showcasing geographic engagement of our fellow geographers and allies in the field. For this evening's lecture, our invited speaker attempts to make sense of the policy shift in the country's pandemic response and reflects on its implementation in Metro Manila. We did a word cloud of your registration submission for this lecture, and dominant words include change, adjustments, innovative, possibilities, evidence-based, transforming. Interestingly, there are also words as hassle, confusing, and palpak under Duterte. Your words, not ours. I think this makes it all the more interesting, and let us all see if these keywords jive into tonight's lecture. On this note, I would like to thank everyone for joining us, and as always, I hope we have a very special and productive session. Thank you.
Thank you very much, Eman. And now I am pleased to introduce to you our speaker for this lecture. Okay. Timothy James L. Cipriano is a graduate student of the UP Department of Geography with his Master of Science Research focusing on the right to the city in disaster risk reduction practice. He currently works as a research assistant for a flood research project funded by the Water Center at the University of Pennsylvania. He previously worked as a researcher at the UP Resilience Institute and NOAA Center. Mr. Cipriano, or TJ, as we call him, is interested in doing research related to hazards and disasters, environmental studies, and disease geographies. He is also a member of the Advocates for Science and Technology for the People, or AGHAM, and the Alliance of STEM Graduate Students and Workers in UP Diliman. Ladies and gentlemen, please give a warm welcome to Mr. Timothy James Cipriano. TJ?
Thank you very much, Ma'am Dar. Allow me to share my screen. I think I cannot share.
Please try now.
Okay. Okay, so good afternoon, everyone. I'm TJ, a graduate student of the Department of Geography in UP Diliman. So this afternoon, allow me to provide some reflections on policy shifts that happened amid the pandemic, amid the COVID-19 pandemic in Metro Manila, especially from a widespread lockdown measures, or we call it community quarantine measures. towards what we call granular lockdowns. Although this is not new in our pandemic response, but this is more institutionalized, considering the fact that the COVID-19 pandemic has changed the way we respond to the crisis, no, especially the Delta variant surge, COVID cases. Okay, so there are 3 points that I would like to discuss tonight, or should I say this afternoon. Number one would be it is important for us to emphasize how the state is actually framing the pandemic itself. Um, why is this important to emphasize? Well, it is because that it has an implication as far as how they implement and formulate policies are concerned, and how they intend to implement it. So we try to look at how the Philippine government or the state is framing the pandemic and how it shapes its response and interventions. That's the first one. Number two, I would like also to try to make sense of the policy shift. So, what led to the shift towards a more targeted lockdown as compared to the widespread lockdown measures? That was pilot tested Metro Manila, but right now it is now being expanded in different regions of the country, considering the risk of transmission. And of course, the so-called alert level system. But I'm not going to discuss more on the alert level system. It's just showing how the policy has shifted towards those. Okay? And lastly, this is very much important. We want to think out loud when it comes to the granular lockdowns. We wanted to ask questions. We wanted to raise some concerns about the so-called lockdown with granules, as social media people would say it, and what are the lessons that can we learn out of the implementation of the granular lockdowns or the targeted curves. So in an attempt to slow down the spread of COVID-19 and what the Philippine government would say, we have to live with the virus. Let us try to make sense of that as well. Okay. It is an attempt to discuss all these within the next half hour. I hope I don't talk too much. Okay. Um, Okay, so before we try to make sense of how the state is framing the pandemic itself, we would like to, or I would like rather, to look at the COVID-19 pandemic as a complex emergency. Okay, so there is a wide recognition as far as our disaster risk reduction management law is concerned that there are complex emergencies. So we see the pandemic as a complex emergency. So when we talk about complex emergency in the language of our law, which is the Republic Act number 10121, is that it is a form of human-induced emergency. So it means that this emergency is caused by humans considering the threat of the virus. So the virus could spread from one person to another, causing government to declare a state of emergency. Um, In addition to that, since we are in emergency, we attempt to provide assistance to those who are affected by the pandemic. Basically, every one of us are affected by the pandemic. And we try to look at how political considerations are also shaping our pandemic response, the way we intervene into the emergency, and how the government would actually think about it. So the COVID-19 pandemic is a public health issue. We all know that. And it has different facets. No? We have the facet of the economy, we have the facet of social well-being, we talk about mobility, we talk about security, and how these facets will interplay with one another for us to further understand how it affects the way we respond to the crisis and how these interplay in terms of how we understand the issue in question. Okay, so let's say how this public health crisis has affected our economy. So many people were displaced. How the public health issue or crisis has affected our social well-being. We are all separated. Although we meet virtually in this particular space. That's why we are here in this lecture series although it's virtual. The public health crisis has affected our mobility, our ability to move from one place to another amid the threat of the COVID-19, and also how this crisis has affected our security. So it's not just security in terms of law enforcement, but our sense of security as well. How safe we are in terms of um, how um, sorry, how safe we are in terms of the of not being infected by the virus, something like that. So all these facets come together, and they are interrelated. That's why it is a very complex emergency. That's the whole point here. We also look at the COVID-19 pandemic as a public health crisis. Today, we reported more than 4,000 cases. Um, and also, it is trying to tell us that the pandemic is posing a severe threat to each and every one of us. So the mere fact that there are more than 4,000 people still being infected by the virus, it also tells us something about it. It remains a threat that even if the cases are going down, many people are recovering, but we have to understand the fact that there are people who are still dying. So that's the whole point of all these, diba? So it's a public health crisis because it poses threat. And we have to understand the fact that any natural event that poses threat to communities or poses threat to human societies is considered to be a hazard. So we consider the COVID-19 as a disease, as a biological hazard that threatens us. So we have to consider that as well. Second, the pandemic is a public health crisis considering the fact that there is a level of uncertainty. Since there is a level of uncertainty, we have to anticipate the effects of the pandemic and anticipate what might happen next. That's why there are projections. Yes. And we have to plan ahead so that we won't be able to 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 reach the projections that we are seeing, say for instance. And lastly, this is a public health crisis because we have to act swiftly. Therefore, we have to act with utmost urgency. So in that case. Okay, so let us try to understand how the Philippine government, how the state is framing the pandemic, which is the issue in question for the past almost 2 years, that we are experiencing this in our lifetime. If our grandparents' generation is defined by the Second World War, our generation is defined by the pandemic itself. So one thing about how the state is framing the pandemic is, if you remember way back during the first week of February, the president has been saying that, there's nothing to be scared about this coronavirus thing. Even if it has not affected the country, it will die on a natural death, etc. So basically, it's trying to downplay the potential effect of the virus. So what, in the language of Lasco and Curato in 2019 and also Lasco in 2020, they would call it as medical populism, wherein there is a characterization of simplifying and dramatizing the public health crisis in itself. Just like how the president has downplayed and made fool, let's say for instance, of the Taal eruption that happened a few months before the pandemic has happened in the country. So, di ba, if you remember, sabi niya, takpan ko lang yung Calvo plane, and then our problems will be solved, something like that. This is actually a political rhetoric on the part of the leader, of a populist leader, to simplify the crisis. Therefore, it requires a simplified solution to that particular crisis. So, in that sense, the state has simplified and dramatized the public health crisis. dramatized in such a way that you have to. It's sending a message to everybody else that this is a great threat. We don't see the enemy, and therefore we have to wage a war against the unseen enemy. And that this is actually connected to the second point. Since they see this pandemic as a war against the unseen enemy, therefore, you will see the president addressing the nation, and you will see the people behind him are state forces. So the presence of state forces will will send a message to everybody else that it shows optics of power, according to sociologist Professor Randolph David. It's optics of power in such a way that this is a great threat to everybody else. You have to cooperate. Um, the government is showing force. No, so that's the thing there. And amid the declaration of state of public health emergency and in the imposition of the enhanced community quarantine, the entire Luzon Island, uh, you will see the image of state forces all over the place. So that's how they frame it, because they would say, they keep on saying it until now, that this is actually a war, no? But this is a different war. They have been saying that. Therefore, later on, it has something to do with the policies that they're trying to implement, no? And and even former Chief Presidential Legal Counsel Sal Panelo would say that it is possible for President Duterte to declare martial law in the entire country because the COVID-19 is going to invade us, no? And he would say that there's an act of rebellion on the part of the people who do not follow health trying to, sow fear among the citizenry, etc., by saying that, martial law is actually here. And martial law is the solution to the problem we are experiencing. So that's how they play with optics of powers, as Professor David would say. And lastly, I would like to emphasize that the state has been framing this pandemic as an enforcement issue, although we don't have any problem with enforcement itself. But the thing here is, we focus too much on restricting movements, although we understand the fact that mobility contributes to the spread of the virus. But it is not only mobility. Now, there are a lot of factors that could affect and even should I say what they call that another factor that could come into play as far as COVID-19 transmission is concerned. So, for instance, you will see there in the implementation of border control measures such as checkpoints, there are a lot of jokes on social media, especially on Facebook and Twitter. They've been saying that you how can you tell the Delta variant, or how can you even tell the virus to stop at the checkpoint? No, will it actually solve the entire problem by simply putting up checkpoints and practically check people whether they have travel documents, travel certificate, health certificate, and all these things, all these requirements that you get from the police, so that you can move from one place to another. So basically, they are framing this pandemic as something that you need to restrict movement. No, there's nothing problem with that. No, but of course we have to focus also on other things rather than just restricting movement, because it has also an impact as far as people's health are actually concerned. No? And people's health do not only refer to physical health, but also their social health, mental health, etc. Okay. Uh, so overall, as far as the state framing of the pandemic are concerned, it's shaping its interventions. No, so we see that we see these framings in the pandemic response of the Philippine government, for example, okay, let us implement community quarantines, let us try to implement travel restrictions, although there's nothing wrong about it, no, but and also public health interventions. Of course, we have testing, tracing, isolation, the PTITR strategy, and then sometimes they have code or the coordinated operations to defeat epidemic, something like that. But as far as the implementation on the ground is concerned, there are a lot of conflicting narratives um, that are emerging. And in fact, as a person who has tested positive for COVID-19 a couple of months ago, I could attest some of the narratives that were emerging amid the pandemic, something like that. Okay? So this is the bottom line here. The framing of the state has something to do with the interventions we are seeing. Just like what I have said earlier, the policies that we are seeing as far as our pandemic response are concerned are shaped by how policymakers are seeing the problem, on how they look at the problem or issue in question. Next, as far as disaster governance is concerned, even if we have different hazards we are experiencing, we have a common system to it. It means that we have a common system in terms of responding to these. So, for instance, in our Disaster Risk Reduction Management Act of 2010, which looks at hazards, not just natural, but different hazards. That's why it's multi-hazard comprehensive response. So we have the NDRMC being headed by the chairperson is the Defense Secretary. Kung mapapansin nyo, yung NDRMC tsaka yung National Task Force Against COVID-19, magtataka kayo sa National Task Force Against COVID-19, why are these people leading the pandemic response? The former military generals, though, especially the people in the cabinet of the president who are former military generals. It is simply because, based on the DRR law, they are part of the NDRMC, and the National Task Force Against COVID-19, especially the composition, is patterned after the NDRRMC. So you get to see General Eduardo Año, General Carlito Galvez, no, General Delpin Lorenzana being there, front and center of the pandemic response, are actually part of the National Task Force. It is really because they're also the key players in the NDRRMC. So when we look at all these, we have a common system that will respond to different hazards. For example, we have Executive Order 82, which tackles crisis management, particularly in armed conflicts, terrorism, sieges. If you remember that the Zamboanga siege, the Marawi siege, they have this composition, or they have this incident command system, that we have the National Crisis Management Council, which is being supported by the National Security Council, no? And at the regional level, we have the public order councils at the regional level, and then we have at the regional level to implement the policies. They have the Crisis Management Council at the regional level and at the local level. And if we're going to look at this last portion here, the interagency task force, whom we love so much, no? We love the IATF so much, that it was actually created in 2014 in response to the threat of the MERS-CoV that was happening, or that was ravaging in West Asia or in Middle East. So the IATF, or Interagency Task Force, the Management of Emerging Infectious Diseases, was actually created by the previous administration. And if you're going to look at the composition of the IATF, it is headed by the DOH. No, because when we deal with epidemics and pandemics, we always look at the Department of Health. No, and later on, it was expanded in the early days of the pandemic, we have the regional interagency task force and the local interagency task force. So basically, they are the ones formulating policies. And when we look at the IATF, if you're going to look at the executive order itself, they have enlisted the help of the state forces. But we have to understand that while it was recognized in the executive order that that the state forces are supposed to be there to assist, they're not actually being front and center of the pandemic response. But it happened that they have been the front and center of the pandemic response. And it's because of the way the state has framed the pandemic itself. No? So, which is being a security issue, an enforcement issue, etc. So, we have all these governance system that we have in place in responding to different hazards. We have a common system to it. And and it's also shaping the pandemic response of the Philippine government. Let's say, for instance, oh, this is actually very crazy to know. It is very ridiculous to note that we have widespread or community quarantines that are that would have different variants. No, actually, we have these have different variants compared to the variants of COVID-19 itself. So we have a lot of variants. For example, we have ECQ, MECQ, GCQ, and GCQ. But if we're going, as time passed by, in an attempt to reopen the economy, the government has resorted to change certain restrictions within the community quarantine regime. So, for instance, in MECQ, we have the MECQ Flex, no, or the flexible MECQ in sometime in A 2021, no? Because if you remember, the mayors have suggested that we should have MECQ Flex. And then if you remember, Octa Research Group would say that, we should have soft MECQ or we should have hard GCQ, whatever that is, no? And we have the regular MECQ, no, which is point blank written in the omnibus guidelines, right? But what's so ridiculous here is we have a GCQ here, but we have GCQ with heightened restrictions. We have GCQ with heightened and additional restrictions. We have GCQ with some restrictions, and we have regular GCQ. So you have a lot of mutations of community quarantines that became variants, no? So what does it actually tell us? The variations of community quarantine regimes would actually tell us that there is something wrong with the crisis communication. So this is a crisis communication in crisis, okay? Because the government wanted to reopen the economy already. So it's like, invoking the balance between the health and the economy, etc., something like that. And then we have to live with the virus. So we have to work our way within the community quarantine regimes and change certain restrictions. Okay? So therefore, you won't blame the public for saying that they are being pasaway, etc., when in fact it is sending a different message to them. Ano na ba? Okay ba ba tayo? Are we okay? What are the restrictions? If you're going to ask people on the street, especially mga pedicab drivers na kakausap ko dito sa Manila, hindi na namin alam eh. So the public is left confused because of the mutations of community quarantine regimes. So it's leaving people confused, no? So the system itself is actually making people confused about what is really happening with the pandemic response, and that is why people took to social media to voice their concern about what is the government even doing, something like that. Okay, now we have now looked at the widespread lockdown measures in various forms and various mutations. But as we try to understand it, what led the government now to tell the public that it's not working anymore. So we have the Delta variant coming to the Philippines and wreak havoc the entire country basically. So I would consider the Delta variant as the tipping point or the critical juncture. When we talk about these terms, it tries to tell us something about there's a need to have a swift action because our plans are no longer working. Therefore, we have to shift immediately. So it enables a rethinking of certain strategies. So that's why it's tipping point, it's critical juncture. So what's with the Delta variant really? So just to give a background, it's 60% more transmissible than the Alpha variant, no? And if Alpha variant is 60% more transmissible than the original COVID-19 strain, which was first detected in Wuhan, this particular variant is 60% more transmissible than the Alpha variant that was first detected in the United Kingdom. So it's twice more transmissible than the original COVID-19 strain. And the basic reproduction number of this variant is around 6 to 9. It means that for every person who is infected by COVID-19, it might infect around 6 to 9 people. So it's really a very contagious variant, you know? And that's why it has driven cases, it's driven the surge in the number of cases of COVID-19. Although some experts don't want to use the term surge, it went to certain mental gymnastics, in the use of epidemiological terms. But anyway, the government has admitted also that despite the strict lockdown measures, the Philippines continue to report record high cases. And they said there's no sign of going down. In fact, in September 11, 2021, we have reported 26,238. That's the highest, that we have reported since the pandemic. And in Metro Manila alone, we have 9,076 new COVID cases in the country. In the region rather. So, and remember, we were under an ECQ, the second strictest lockdown measure in the previous community quarantine regime, because right now we don't use that anymore. So despite being under NECQ, we have reported this number of cases, and therefore, the government said that we have to change the way we implement our pandemic response. So the government has been telling us, okay, it is within the projection of faster, etc., but it's no longer working. And data coming from the Epidemiology Bureau of the DOH in September 2021, they said that 80% of the total cases in the National Capital Region are coming from 11 to 30% of its barangays alone. So they said, why don't we shift to a more targeted lockdown measure and we regulate certain activities that promote 3 Cs, which is close setting, close contact, and crowded areas. So that is why they shifted from a wider community quarantine regime to the alert level system, which regulates activities in 3 Cs and granular lockdowns. That's the reason why they have shifted towards that particular policy. And I just wanted to underscore the fact that the granular lockdowns are nothing new in the pandemic response of the government. In fact, this particular strategy was implemented way back in June 2020. The reason behind it is because we wanted to reopen the economy. We have to live with the virus, etc. So the National Action Plan against COVID-19, especially on the second and third phase, would focus on, in Filipino, they would say, ingat buhay para sa hanap buhay, something like that. They wanted to to bring back jobs to the people, etc. And we have to target it. So they identify critical zones depending on the prevailing clustering of cases, or we call that as epidemiological parameters. So there are different ways on local governments can implement granular lockdown, such as, let's say, barangay lockdown, block lockdown, or a certain block, you can lock down that area if there are clustering of cases. Minsan may subdivision pa yan, may purok. There are street lockdowns, house lockdowns, building lockdowns, establishment lockdowns, or whatever lockdowns in various formats and variants. Um, for as long as the local chief executive would say, we have to prevent the further spread of the virus, we have to lock that particular area down. Something like that. Okay? Next. Even granular lockdowns have different variants. Say, for instance, in Manila, they would say it's a barangay lockdown, or in the previous implementations of granular lockdowns, they would call it as barangay hard lockdown, no? And then previously, before it was instituted by the interagency task force, it depends on the local government unit how many days they're going to implement the granular lockdown. So, for example, in Manila, they will only implement 4 days. In Quezon City, they have the so-called special concerned lockdown areas, wherein for 40 days that area is locked down, no? And there are different dynamics at the time before it was institutionalized. But right now, in the current setup, granular lockdowns, the standard granular lockdown should be 14 days. So it means that you cannot impose less than 14 days, or it depends on the situation in the area, whether you're going to live it or not. That's according to the interagency task force resolution. No? Okay, so we try to make sense of the granular lockdowns, how it's supposed to be implemented. And there is a recognition, in fact, that in the National Action Plan, in the areas where granular lockdowns are implemented, there should be an intensified tracing and testing. Okay? But as we try to reflect, is this really happening on the ground? No, because we have been hearing stories about it that even close contacts were not even tested. Later on, let's try to look into that. So let's try to think out loud. What are the concerns? What are the questions that we should raise when the implementation of granular lockdowns are being espoused? No. So number one would be, we have to underscore the importance of granularity of data. Okay, how granular is our data? So let's say, for instance, in the DOH data drop as of October 27, which is Wednesday. Yesterday, we don't have data drop yet. Baka siguro meron na ngayon. Out of the 2,768,849 total COVID-19 cases reported in DOH, there are 288,507 cases that have no barangay residence data. And there are 52,961 cases that have no city or municipal residence data. So what does it actually tell us? It only tells us two things. Number one is that what does it say about how we monitor our cases? So when we monitor our cases, it has an implication as far as disease surveillance is concerned, or tracing. So how is our tracing? What is going on with our tracing? Kasi walang follow-up. Kasi kung hindi natin alam yung kung saan lupalop sila ng Pilipinas nakatira, then how can we even trace them? That's the problem. Or maybe there's a problem with the data source. Baka hindi na babalikan, etc. But it has a story to tell. No? Even a portion of the story, it's the entire story. But the portion of the story, it tells us something about the status of our contact tracing. And number two, um, if we don't have if we don't have granular data, then how can we look at the bigger picture of the outbreak? It is very important that we have granular data at the level of the barangay, for instance, so that we get to look at the bigger picture of the outbreak. Say, for instance, okay, so the mayor is going to implement a lockdown in barangay X, and then barangay Y is adjacent to barangay X, for instance. So, ang problema, magkaibang city si barangay X at si barangay Y because given the porous area, for instance. So, paano yun? How do we look at that particular dynamics? And of course, there's politics behind it, but how do we look at that particular dynamics? So, may mga ganun tayo dapat tayo tinitingnan dito. Remember, in any disasters, in any crisis, not in my backyard policies won't simply work. Yung kanya-kanya or NIMD or not in my backyard won't actually work. It is because the virus doesn't even squabble political boundaries. It don't even tell the virus to stop at a checkpoint. Hindi ganun yun, di ba? So we have to look at how robust is RGC surveillance. And it has something to do with contact tracing efforts. We don't know what is going on in our contact tracing because there is limited available data to the public. So let's say, for instance, according to the situation report of the National Task Force Against COVID-19, actually this is accessible in the NDRRMC website, so you can check it out. In the national level, it says that our case-to-close contact ratio is 1:8. So basically, they were able to trace 8 people per confirmed case, something like that. No? Actually, this is an improvement as compared to September. It was actually 1:4, 1:5. No, this is already an improved sign in that sense. No, but in Metro Manila, according to MMDA, it's 1:15. No, so it's actually a good progress. That's according to the MMDA chairman himself. But Mayor Benji Magala has been saying this all along that. Tracing is the weakest link in the pandemic response of the country. If tracing is actually the weakest point in our pandemic response, then the entire thing is actually very weak because hindi natin nakukuha yung mga taong posibleng nahawa, hindi ba? Especially the time limit that the DOH has been imposing is 24 to 48 hours. And then, amid the airborne transmission of COVID-19, which tells us something about close contacts. Kasi, ang sabi ng DOH, when we talk about close contacts, kailangan 15 minutes ang minimum interaction yung dalawa, tapos within 1 meter. Eh, kung ang COVID-19 ay nagsispread through airborne transmission, will that hold true? Diba? So we have to think about it as well. Okay. Okay, another question would be, do our localized lockdowns really target the problem at the source? So it always goes back to how robust is RGC surveillance. Are LGUs even empowered? they have resources, for instance. When we talk about granular lockdowns, it's actually a good strategy on paper for as long as you have a robust disease surveillance. Kumbaga, na-identify mo saan yung outbreak mismo. I mean, where the outbreak is. Okay? In the Philippines, especially in Metro Manila, for instance, the usual target of granular lockdowns are in the communities. Which is okay. Because may mga communities sa dikit-dikit talaga and you don't want other parts of that community to be infected. That's why you have to lock down. And that's okay. But if we are not able to target the source of the outbreak itself, then that also poses danger. Kumbaga, paulit-ulit lang ito. No? You have to also ask, are some establishments being locked down? Kasi may mga establishments naman na locked down, but we don't hear it too much, no? Let's say, may nasasarado bang mall because of an outbreak inside the mall. Because it's too focused in the community, something like that, which is okay, just like what I've said. But how about establishments? Kasi wala tayong narinig about malls. Does it even tell us that malls are safer? We don't even know, di ba? And health experts have been saying that, the battleground of COVID-19 transmission has shifted to households, which I would like to contend it's not, no? It's just secondary because all infections are linked with one another. Hindi naman makukuha ng isang tao yan na naka-stay at home lang sa bahay without a person going out and possibly infected elsewhere. Diba? It just so happened na marami na infect sa bahay. It is because there are no opportunities for physical distancing, lalong-lalo na sa mga bahay na maliit lang. For example, dito sa loob in Manila, for instance, may mga informal settlement communities ako napupuntahan na ganito lang kalaki yung bahay, as in the size of my room. And there are 12 or 15 people who are living in that particular space. Where is social distancing or physical distancing there? There are no opportunities. So even physical distancing is actually a privilege, no? Because of the conditions that people are living, especially the precarious situation living. So I don't believe that the battleground has shifted to households. The battleground remains at 3Cs, which is the crowded areas. It's not just in the households, rather, but in other areas that promote 3Cs. Close contacts, crowded areas, and close settings. Ibig sabihin, for ventilation, like, how do we make sure that our work areas are safe? Diba? So we have to employ some administrative and engineering controls there, like ventilation, for instance. If you remember, there are 2 episodes of outbreaks in MRT3 alone. No, in 2020 and in early parts of 2021, there's an outbreak that happened in MRT, especially in depot. So what is happening in the depot? In the depot, kulob. Diba? So there are opportunities that maybe a worker went into that particular area, nag-interact, kasi medyo crowded yung area yun, closed, walang enough ventilation. So talagang nagkaroon ng outbreak. No? And even in LRT depot and PNR depot, doon nagbumula yung mga outbreaks according to DOTR. So there's a question now on how safe our workplaces are. And considering the structural inequities that drive COVID-19 transmission, for instance, how do we intend to address that? Right? So that's actually the thing about this. Okay? Or for instance, in Quezon City, workplaces are considered to be hotspots for COVID transmission. So how do we make sure that our workplaces are safe? I think this is second to the last, I guess. No, our gradual lockdowns emphasizes too much on restrictions, while intervention targets and metrics of success are lacking. So, for instance, we have to ask the question whether people in gradual lockdown areas are tested for free. Are all potential contacts up to the 3rd and 4th generation are traced within 24 to 48 hours based on DOH standards, and are they all tested? Why? It is important for us to know that so that we'll be able to understand and we'll be able to gauge whether these measures would have actually worked, no? Kasi ang MMDA, sinasabi nila parate that, nabawasan ng granular lockdown areas namin. So from 9,000, right now it's 1,000 plus, no? 1,000 plus areas under granular lockdown. So do we consider that as part of the metrics of success of the GL policy or whatever? I also asked that question because there are instances of some LGUs that even if they are symptomatic, close contacts, they are symptomatic close contacts, but the barangay health emergency response team said, mag-quarantine ka na lang for 14 days. There's a chance that there are other close contacts who were not even tested for the virus, even if they're showing symptoms. So again, there is a gap again between the policy, the implementation, and altogether, etc. And also, how accessible our testing is. Diba? Kasi, for example, there are LGUs that provide free testing, pero you have to go to other areas pa just to avail of the testing, free testing in the community, etc. So, although we understand that the LGUs are short of resources also, something like that, right? And last but not least, we have to ask what particular data will tell us to decide whether to lift the granular lockdown measures or not, on what particular conditions should we lift granular lockdown measures in the area. So we have to ask that question as well. And lastly would be, our granular policies are point blank, no? Parang ito lang gagawin nyo, hindi nyo pwede gawin to, etc. Well, which actually intensifies the precarious conditions of the urban poor and the informal workers. So, may mga informal workers na no work, no pay. So, how do you even compensate that? Right? And this is supposed to be adequate. Sorry about that. This is wrong. This is the typographical error. But are there adequate social safety nets, economic protection for displaced individuals? Are these actually enough? Does it compensate? Kasi baka mamaya, yung binibigay na ayuda, hindi siya nagko-compensate dun sa kinikita ng taong yun or whatever. And we also have to emphasize that our policies would emphasize too much on individualizing COVID risk. And therefore, we keep on saying to people, wag kayong magpasaway. Although may mga pasaway naman talaga, but we put too much effort in terms of telling people wag kayong magpasaway and you have to follow health protocols, etc. When in fact, the structure itself is not enabling the health protocols to be followed. Na nagpapasok ka ng mga tao sa opisina even if there are no health and safety protocols in place. Something like that, okay? Now, last point. So what's next after learning about all these things? What are the lessons that can be learned from our pandemic response, from implementation of granular lockdowns, etc., in order for us to assess it well or to properly appraise it? Because remember, just like what I've mentioned, there is limited data available for us to assess it. This is why this lecture is more on reflecting on and raising concerns and points of discussion about what could possibly happen when we implement this. Okay, first off is that we have to democratize our COVID-19 data. And the reason why we have to democratize it is because we have to reclaim our space to participate in co-producing knowledge and in governance. Diba? So we also have a stake here. Since this is a public health issue, everybody has a stake here. Public health is way too important to be left to medical doctors alone. So everybody has a stake, and therefore, if we have COVID data that is available to the public, everybody will be able to participate and perhaps properly assess and properly or have a better appraisal of the policies that are being implemented by the government. So that's one. Number two, there's also a need to democratize COVID data. It is because to promote transparency and accountability among those in power. Diba? Kasi remember, we have to keep the government in check. And democratizing data is an aspect of reclaiming that space of participating in that particular endeavor. And democratizing COVID data will allow us to promote community care. no? Since we care about people, we care about um, our conditions or living conditions at hand, we have to participate in these endeavors so that we'll be able to put an end into this pandemic. Um, and also, I just wanted to emphasize that there is a need to be open with emerging evidences, no? Emphasized earlier, we have to really think about close contacts, etc., so that we will be able to recalibrate our response. Okay, because if our thinking is the framing of transmission is still droplet and we don't consider it airborne, then maybe it is maybe we are still in this mess at this point. Diba? Kasi remember, um, uh, science evolves through time as new evidences emerge. So we have also to be open with emerging evidences so that we'll be able to properly recalibrate our pandemic response so that we can get out of this mess. And lastly, we cannot afford to shotgun in the implementation of granular lockdowns. Therefore, it has to follow the science. It means that if you were able to identify the source of the outbreak, then that's a good thing to do and the step towards the right direction. And it must be pro people. You have to put the people front and center of the policy that you're implementing. It's not just putting the state forces front and center of the pandemic response. It's always the people because we're dealing with a public health crisis. And therefore, since we are in a public health crisis, everybody is affected by this particular crisis. So that's the whole point here. So it has to follow science. You have to strengthen our healthcare system. And remember, healthcare system does not only refer to the increasing the hospital bed capacity. We also have to improve our primary care. We have to take good care of our communities by ensuring that there is a better access to healthcare, especially testing, hindi ba? Dapat libre na ang testing, something like that. We have to be aggressive our public health interventions. We need to be more preventive rather than our pandemic response be hospital-centric, no? But our problem is we care too much about the healthcare utilization rate without taking into account how can we further ease the burden of hospitals. We have to detect those people who are possibly infected by the virus. And also, we have to take into consideration of social safety nets, for instance, economic protection for the displaced workers or those afflicted by the virus and those affected, like everybody else. Yeah. So it has to follow science and it must be pro people. Because if not, we won't be able to get out of this pandemic. So with that, thank you very much and good evening to everybody.
Thank you. Wait lang. Thank you so much, TJ, for that enlightening and wonderful presentation. We will now proceed with the open forum, and it's now time for your questions. We encourage you to type in your questions in the Zoom chat box or in our social media accounts for those watching via YouTube. So are there questions for TJ? Anyone who wants to start the ball rolling? Questions? Anyone? Wala ba tayong mga katanungan kay TJ? Okay, so kung wala, TJ, I would like to ask this question. Towards what direction yung policy shift do you think will be in the next months? Because it seems that, well, I do not know if cases are really decreasing, or there might be some cases that are not detected, no, due to uh, lesser numbers being tested, or what. So what would be the shift in the policy? What do you think?
Um, Thank you very much for the question, ma'am. Actually, when we look at policy shifts, maybe in the next months we have to look at how the granular lockdowns will actually work in the broader scale, um, because the granular lockdowns are just recently instituted, although it's just like what I mentioned, it's not actually new in our pandemic response. But we have to see first on how these targeted uh, curbs or granular lockdowns. The MMDA said it's actually working. The alert level system is working because we are trying to regulate activities that promote theses. But we have to have a data that is available to the public to make sure that it is indeed working. And that this is why it is very difficult to give a better appraisal of the policy. This is because the data is not really available to the public for us to critically appraise the policy. But moving forward in the next few months, I think we are seeing this to be adopted the entire country as the government looks forward to further reopen the economy and live with the virus. So that's what they're trying to do. And even Singapore, for instance, they're living with the virus as well. Although New Zealand is not subscribing to the notion of living with the virus, but they wanted zero COVID. They're still adopting the zero COVID policy to further reopen the economy and bounce back to pre-pandemic levels. So as far as Philippines is concerned, for as long as the framing of the pandemic and as well as the logic that is being pushed forward, which is to balance the health and the economy, when in fact we have to prioritize health first before the economy, considering the fact that we cannot have a good economy if we have sick people. Parang it's Filipino they would say na aanhin ba natin ang ekonomiya kung patay na ang tao. So I think the government is gearing towards that particular aspect, not unless there is a shift in those who are governing the pandemic response, I guess.
Okay, thank you, TJ. Kevin Cordovis posted here in our chat, no? I think an article from Rappler. Well, I think this is something worth reading. Or maybe Kevin can share us something. Yes, Kevin, go ahead, please.
Ay,
Please unmute. Yeah.
hello. Rinig po ako.
Yes, go ahead.
Magandang gabi po sa inyong lahat, plus Kevin. Maraming salamat TJ sa napaka-informative na lectures tungkol nga sana yung pag-evaluate ng pandemic response sa bansa natin. I appreciate ko yung yung paano mo na-frame mo siya sa like in terms of hazard management, disaster management, and that kasi public health matter man siya, pero it intersects talaga with other aspects, socio-economic, physical, yung sa health part, diba? Socio-economic, mental, social. I shared this article kasi in line with yung nabanggit mo kanina na yung kailangan mag-shift. Ideally dapat nag-shift sa plan when when things change, like, di ba, with the case of Delta, yung more transmissible. So, I shared this article kasi nga may recent news daw na may bagong variant strain. Pero under monitoring pa lang daw siya. Apparently daw itong bagong variant na to has similar mutations with Delta and the UK variant. So, and galing siya sa North Africa, Mauritius. I think hindi ko alam kung galing sa OFW to or foreigner, pero yun nga, given nga na yung current pool of knowledge nga regarding dun sa mga trends sa pag-mutate ng virus, there's a chance na this might be another variant that might take over if it spreads, like, if uncontrolled. So in line of that, tapos on the backdrop na barely over 20% pa lang yung fully vaccinated sa bansa, whereas our neighboring ASEAN countries are, like, Singapore is like almost 90% na, Malaysia is 80+%, Indonesia is more than 50% na. How does one, hindi, paano ba ito? In light of that, diba, na-mention mo din yun with our other Pacific neighbors like New Zealand na zero, as much as possible, zero COVID. And ang ginawa nilang policy dun na while they are slowly easing restrictions, they're doing that hand in hand with ramping up vaccinations. So if that's the case, so why is it that the vaccine rollout is still slow? Yun nga, yung nabanggit na ini-individualize yung responsibility ng COVID, sinisisi tayo na pasaway. And then you mentioned nga na change of governance. How does the common people navigate through all of this? Siyempre, may may pandemic and grief fatigue na nga rin with posts on FB being always may namamatay or nagkakasakit. So, in light of our constraints that we didn't choose to be under, as someone from the JOG and the disaster management sector, what do you, in your opinion, what is the best way to navigate through all of this? Kasi mabilis nga yung development. Like, anytime this variant could either fade away, fizzle out, or explode. And yun nga, while your talk is very informative, pero yun nga, I'm still confused overall with the situation. Like, how would you, anong general advice mabibigay mo sa common person in light of all of this?
Wow, it's actually a very good question to ask. At the same time, it's a very difficult question to answer. But we need to, number one, demand accountability for all the things that the government has been doing. As far as vaccine rollout is concerned, we have to call government in terms of we have to ramp up our vaccination rollout. Kasi considering that, let's say for instance, 100 million doses na dumating sa Pilipinas, they have been touting that, especially in presidential press briefings and in several interviews in media and also press conferences. But there's a question how they actually roll it out, no? Bakit hindi pa rin naro-roll out sa mga probinsya, considering that Metro Manila has a high vaccination rate already? Why don't we already distribute that as fast as we can, no? So hindi ba na-anticipate yung mga ganun mga bagay? But that's actually part of government strategy. But as far as as far as people are concerned, like us, no, it is understandable that talagang we are experiencing pandemic fatigue. Kasi nga, because of all these confusions on community quarantine measures, policy shifts, etc., they're trying to experiment with which works better, which is not working, etc. So, ganun daw kasi kabilis yung developments. Pero we have to go back on the basics, di ba? Whatever variants that are emerging, we have to strengthen our detection of cases. Yun kasi yun eh. Kahit ano pang variant pa, kahit nakakahawa pa siya, for as long as we have a robust disease surveillance efforts, that the government has to prioritize as compared to, let's say, infrastructure projects, build, etc. Kung dito tayo we won't have any problem with certain virus because that's the nature of the virus. It mutates. But if our response remains slow and we are hesitant in terms of controlling our borders or even if strengthening our disease surveillance, then nothing would actually happen. That's why I will always emphasize, no matter what lockdown measures or policies we are going to implement in terms of regulating movements. I've been saying that it's always about regulating movements, but it has to come with aggressive public health interventions. Kaya, kung mapansin natin, without too much about healthcare utilization rate, hospitals, etc., we have to build hospitals, etc., when in fact, it is not supposed to be like that. It is supposed to our pandemic response is supposed to shift towards the communities and detect those who are sick, make testing available to the workplaces. Like for example, in different countries, the testing is actually accessible to everybody else, etc. In fact, in our country, we're very much conservative with PCR tests, and we all know PCR test is very expensive. In personal experience, I have to shell out 4,000 pesos just to have myself tested. And I think ikaw din. Diba? So parang,
sakit nga sa bulsa.
yeah, diba? So parang, it is actually, it all boils down to how the government has responded to the pandemic and how it intensified or it did not, how it intensified or not its response. So that's actually it. And also there's a problem with anticipating the potential threat. No, kasi nasanay tayo dun sa fact na, okay, let's wait for it. And then kung nandyan na, tsaka tayo kikilos. Yung mga ganun tayo, mga notions, especially in governance, for instance. And it's not just in COVID, in other policies. Parang sabi nila, hindi namin na-anticipate yung ganito, hindi namin akalain na ganito ang nangyari, etc. Diba? There's a maybe there should be a shift in terms of way of thinking as well, something like that. But it's not all. We don't put that burden on the people, but we have to put that burden on those who are implementing certain policies, and we all have to go back to policymakers because they are the ones framing the issue in itself. If their framing is still like this, then there's nothing will actually change as far as policy is concerned. I hope I was able to address your question. Feeling ko parang it jumped all over the place, but I hope I was able to.
I just have one last follow-up na lang siguro. Kasi nga,
okay.
na-mention mo na nga yung pandemic fatigue. I've noticed online and in the news, though minority pa lang sila, which is good compared to our Western counterparts. There's a small but gradually getting loud na anti-science, anti-vaccine, anti-medicine sentiment. And among a few of those I've interacted na surprisingly non-toxic kasi usually mga trolls sila. They tell me that they end up believing these, things, like ivermectin stuff, vaccines don't work kasi may mga, yun nadadala sila sa mga testimony na may kilala daw sila na friend nila na vaccinated pero nagkasakit pa rin, which makes them start doubting the healthcare system, medicine, science in general, and even some of them are becoming antagonistic na towards our frontliners, our healthcare workers. Bilang isang science communicator, paano mo sila kakausapin yung mga ganun na yung pinanggagalingan nila ay dulot ng fatigue at pero nalulong sila dun sa anti-science, anti-intellectual, anti-vax sentiment. Bilang science communicator, how do you approach people like that in dialoguing with them in a proper way without being too antagonistic? Kasi they're risking themselves by choosing to be misinformed or by continuing to be misinformed. And I think that's also another pandemic din, yung misinformation pandemic, di ba?
Okay, it's another good question. No, I guess we have to understand kung saan ba sila gagaling. We have to ask bakit sila naniniwala sa ganon. But of course, we have to look at the bigger picture as well. Let's say, bakit sila nag-resort sa ganong train of thought, no? Or naging, it's like desperate times call for desperate measures. That's why people resort to subscribe to the notion na kailangan quick fix lahat, no? Kasi nga we have been in this pandemic for almost 2 years and parang the future is too bleak for all of us. So parang we have been so desperate, so we have to understand where they're coming from. At the same time, the conversation has to go on. Hindi naman yan isa-isang upuan lang and then you talk to the person about ano ba pinanggagalingan niya about vaccines, about medicine, etc. Well, I'm not an expert on medicine and vaccines, etc. But guess we have to we have to continue to converse with them, no? Kasi para siyang pangahabig, di ba? Parang hindi naman agad siya depende naman yan kung mag-change agad siya ng isip or hindi, no? But the conversation has to go on and you have to show your willingness to listen to the person, and later on siguro from there we build up on bakit kailangan natin magpabakuna, etc. Kasi may mga taong nagsusubscribe to tinatawag na survivor bias, di ba? Like, hindi naman siya delikado mga ganon, di ba? Or those. So we have to be very aware of those, I guess. And yun nga, we have to continuously engage with the person kasi hindi lang naman siya, iisa lang yung sa isang instance lang. There are many instances that you need to talk and to be patient with the person. Ayun.
Okay, thank you, TJ.
Okay, thank you,
and
thank
Thank you, Kevin, for that question. Now, before I call on another question from the audience, I would like to acknowledge there's a comment from our YouTube audience that what we need is a scientific response, to this pandemic. Okay, and I'd like to call on Dr. Jake Kadag. I think he's raising his hand. Jake?
Thank you, Ma'am Darl. Hello, everyone. Hi, TJ.
Hi,
I came in late to Zoom, but I was watching you sa YouTube kanina. But anyway, At marami tayong nakikita na similarities between COVID-19 and climate change and disaster risk in general, including yung mga yung mga earthquakes. No? But let me focus lang muna sa climate change. Yung similarities, I think, ay COVID-19 is very uncertain, katulad ng climate change. And we also experience pandemic fatigue, katulad ng napag-usapan po kanina, like apocalypse or yung green fatigue or climate change fatigue. Like we can see a lot of articles about it. And there's also that anti-COVID-19 science. And like what we have, yung anti-climate change science. And I think yung isang na-emphasize kanina ni TJ is yung COVID-19 affects yung mga vulnerable population. And I think that's also the case for climate change. And ngayon, nakikita natin yung so I'm trying to establish yung parang similarities ng dalawang big crisis na ito. Yung nga lang sa COVID-19 talaga nafe-feel natin, nakikita natin may mga namamatay na tao sa paligid natin. But like climate change, although hindi ganoon ka-direct, we know that it influences or make yung ating mga natural hazards more intense, o kaya mas malalakas sila ngayon, and that results to possibly more impacts. So in a way, parang indirectly may namamatay. Marami ding mga namamatay. But ngayon, yung ating, what do you think, TJ, in terms of response, and we see that in climate change adaptation, especially mitigation part, many scholars or decision makers are saying it's not really working. Do you think because of those similarities with COVID-19, time comes, sana naman hindi but do you think we're heading that way? Or, and yun yung first question. The second question is, hindi naman question, but siguro your comment on, baka marami ba tayong matututunan sa COVID-19 ngayon? To also address yung ating mga climate change issues. Kasi kung nakikita natin na similar itong dalawang ito, kaya lang yung COVID-19, it's here now, we feel it now. Parang shorter compared to a long-term climate change. But essentially, they're the same. So do you think we can learn from COVID-19 to also address yung ating, or learn from it to address yung ating yung climate change issues that we encounter? Yun lang po. TJ?
Sir, thank you very much sa question. Regarding your first question, whether the direction of COVID-19 is going to be an endemic or not, that will purely depend on how we respond to the pandemic. So, and here's the thing though, even if we continuously address the pandemic through certain public health interventions, etc. But remember, it's also a global issue. So may usapin siyang scale. So just like what they have been saying, everybody is, not everyone is safe until everybody is safe. So there are issues, let's say for instance, of vaccine inequity. May usapin din yan ng, for example, ng issues of equity, etc. So, kinakailangan, this particular problem, like climate change, may similarity sila in terms of global cooperation. I mean, lahat ng bansa dapat we have to commit on that because we are bearing much of the brunt of the climate change, just like we are bearing much of the brunt of the pandemic, considering that the vaccines are being hoarded by Western countries. So I think these issues are connected with one another, and therefore, on the part of the Philippines, we should not always depend on the vaccines. All the vaccines work, but it should be coupled with other interventions such as testing, isolation treatment, faster detection of the virus. So I think that particular combination should be put spot and center of our pandemic responses. So that's number one. Number two, if there's anything that we can learn from COVID-19 as far as climate change is concerned, just like what I have mentioned earlier, it's actually not only increasing global cooperation, but also um, we anticipate the potential impact of an emerging infectious disease because remember, just nabanggit mo nga sir kanina that climate change brings about uncertainties, just like just like the COVID-19 pandemic, or we might have future pandemics. It's not just COVID-19. Experts have been saying this is not the last pandemic. And since climate change and COVID-19 are closely connected with one another, we have to go back to bakit nga ba nagkaroon ng COVID-19 in the first place? Because we have disrupted the nature, etc. No? And that is why these particular issues are actually connected and maganda na napag-connect ni Sir Jake kanina. So, we have to we have, as far as disaster risk reduction is concerned, we have to subscribe to the notion of nature-based. Ibig sabihin, we let the nature do its recourse. No? Kasi COVID-19 pandemic, just like what Kevin said in the chat box, is an environmental issue as well. So, yung COVID-19 pandemic, ang dami niyang issues na natatouch. And that's why we saw a lot of intersections between climate change and COVID because of all these particular issues at hand. So dapat we were able to find our system, we find our health system that will be able to address future pandemics later on. So our DRR must also be primed to that. Especially this is a lingering or a slow onset disaster that we are in right now.
Okay. Thank you, TJ, no, for that enlightening talk again. No. Now, to show our appreciation for our speaker, the Philippine Geographical Society would like to give a certificate of appreciation to to TJ for his invaluable insights and expertise this evening. Allow me to read the certificate. This certificate of appreciation is given to Timothy James Cipriano for sharing his valuable insights and expertise as virtual resource speaker for the talk Reflections on the Policy Shift from Widespread to Targeted Curbs in the Metropolis Amid the COVID-19 Pandemic, as part of the Philippine Geographical Society Lecture Series 2021, held on October 29, 2021, signed by Joseph Palis, PhD, Chair of the UP Department of Geography, and Emmanuel B. Garcia, ENP, President of the Philippine Geographical Society. Okay. Thank you once again, TJ, for sharing your research. And it seems that our battle with COVID-19 is going to be a long haul and a big challenge. Okay. So I would like to, as we are now at the end of our program, I would like to call on Professor Eman Garcia, the president of Philippine Geographical Society, to give the closing remarks. Eman?
Hi, ma'am. Thank you po. Thank you, TJ, for your wonderful talk. This is not really closing remarks, but just to give you updates on what the Philippine Geographical Society is doing. The Philippine Geographical Society Lecture Series is a continuous event, no? And for November, we have two lined up speakers for the PGSLS. The first one is Patricia Albura on November 19, 2021. And then the second one that we're going to have for November is from Lisa Marshall on November 26. We will keep you posted through the publicity materials that we will be posting with regards to this event. Next, the Philippine Geographical Society has an ongoing call for membership, open call for membership. just visit our website, phgeographicalsociety.org, to learn more about the membership for the Philippine Geographical Society. For feedback, kindly visit this site para po makapagbigay kayo ng feedback sa ating PGSLS for us to continuously improve kung yung pag-deliver po natin ng PGSLS natin. And then last, if you want to revisit the past episodes of our PGSLS, all the talks are uploaded sa UP Department of Geography YouTube page. The talk ni TJ right now will be posted there later on, pero nandun din yung mga previous talks natin in the past. And lastly, we're happy and excited to announce po itong ating International Conference on Geographical Studies. Next week na siya. So sana magkita-kita po tayo doon. This is on November 4 to 5. Virtual po itong ating ICGS. And in relation to this, saktong-sakto po sa talk ni TJ sa ating PGSLS, pinapublicize na rin po namin, nilolaunch namin ang official website to complement our publicity materials on ICGS. So you can visit the website via this link. Our BOTs will also post the link sa ating chat box. You can see yung program, the details ng plenary speakers natin, some FYIs, the ad hoc committee, and other announcements will be posted there using this website. So yun lang po. Maraming salamat, Ma'am Darl.
Okay, thank you, Eman. And we would like to thank everyone for joining us